Hi, Dr. Susan here, and I wanted to talk to you about the most common questions that I hear about labiaplasty in my office. You know, labiaplasty is usually a reduction of the labia minora, which are those inner lips that we have in our genital area that sometimes can be longer than we prefer. They can be asymmetric. Sometimes they can have darkening around the edges. All of these things are normal and none of that needs to be changed, but sometimes it can be bothersome. You know, for example, a lot of my patients ride bikes like I do. I'm a triathlete. When I'm riding a bike, if the labia are longer, they can get pulled, they can be irritated, they can even get chafing and blistering. Sometimes with intercourse, the longer skin can get pulled inside or tugged and feel uncomfortable. Often because that skin is longer and it falls in folds, we can get discharge and irritation in between the folds that can just be a daily annoyance. So again, none of this is necessary, so to speak, but it can certainly improve our quality of life. So that's talking about reduction of the labia minora, and when we do that surgery, when I do that surgery, it's something that we really have to take quite seriously because this is permanent. You know, we're removing tissue and creating a new look that's more comfortable for you. So not only is it more comfortable because now those labia minora edges do not extend outward beyond the outer labia that are called the labia majora, so that when we stand up, now we just see a smooth profile. So when we're riding a bike, when we're wearing a tight swimsuit, maybe wearing our yoga pants, we don't have to be tucking stuff up in there. When we're having sex, there's no skin being pulled inside, which can all be kind of annoying. Again, all of this is normal, and if you're happy with the way you look, that's great. But you are able to change that. I believe that each of us has control over our own bodies, and if we do want to make that change, it can, in some cases, improve our quality of life. So why not, if that's something that you desire? So that's discussing the labia minora, and I do that surgery with anesthesia. So some of my patients ask, you know, why don't we do this with local anesthetic in the office? The answer is it's because it takes about an hour and a half. It would be quite uncomfortable, as you can imagine, having local anesthetic injected in that very, very sensitive area. I also want to make sure that we don't alter the tissue planes by putting a lot of liquid underneath the tissue. That way I can ensure that we have perfect symmetry and a really beautiful result. But most importantly, I want you to be completely comfortable and not to be nervous or anxious, because I sure as heck would not want to be awake for that procedure. So it's done in an outpatient surgery setting, go home the same day, short recovery, couple of weeks before you're up and about doing pretty normal exercise, but just a few days off work. So, you know, really something that's quite doable for most patients. Now, some patients also ask about the labia majora. That's that outer skin that often can lose fat and look a little bit deflated as we get older. So I'm 53 years old, and when I was younger, like my 16-year-old daughters, my labia majora was kind of fat and puffy, and you know, when I sat on that, it felt quite comfortable. Now, as we get older and we lose that fat, it can be quite uncomfortable. For example, riding a bike, again, as I mentioned. So we can do things to either put some filler, like your own body's blood, platelet-rich plasma, which I talk about a lot elsewhere, into that tissue to fill it, or we can remove some skin to make that skin a little bit less baggy. So those are some of the most common questions that I hear about labiaplasty, and you'll find lots more information about that on the website here at drsusan.com.